For this patient, it is important to work on the lower third of the face. In these indications, Dr. Krabai will use Hyaprof balance that is optimal for moderate to deeper layers and will give a filling effect to smoothen the lines and folds. To create a more prominent mandible, a 25G cannula and a 27G needle is used. After making the entry point with the needle, a cannula is used until the defect is repaired. As you can see, the application is very smooth and requires minimal effort. From the same entry point, it is also possible to enter the lower part of the mandible. Remember to gently massage the area that has just been injected. However, in the case of Hyaprof, it is not necessary to do it for a long time, as the product has a very seamless dermal integration. Krabai is going to perform the same procedure on the other side. The cannula is inserted straight down to the chin and close to the bone. With these injections, we already corrected the defects of the chin that usually appear as a result of the natural aging process. Dr. Krabai is now changing the cannula, and he will inject the upper part of the marionette lines using the retrograde movement and supporting the lower lip. The nasolabial area must also be injected to give the patient a more youthful appearance. This will be performed using a 27G. The results are already starting to be visible. For the lips, the vermilion and then both lower and upper lip will be worked on using a 27G needle. Starting with the lower lip, in the area of the vermilion border, 0.1 milliliters of Hyaprof is injected. The same is repeated for the upper lip with additional 0.1 milliliters. The lower lip should be bigger than the upper one in order to respect the natural facial proportions. Dr. Krabai is injecting only a small amount in the central part of the upper lip, finishing with correcting the empty spaces and giving more volume to the lower lip.